AI coaching is often promoted as a convenient and accessible form of support, and for many people dealing with everyday stress, it can genuinely offer structure, reflection, and motivation. But when the conversation shifts to individuals living with serious mental illnesses, conditions like major depression, bipolar disorder, psychotic disorders, PTSD, or complex trauma, the stakes rise dramatically. There are positive aspects worth acknowledging. AI can help people track symptoms, organize thoughts, practice grounding exercises, or reinforce healthy routines. For someone who struggles to articulate their emotions or maintain consistent habits, that kind of gentle structure can feel stabilizing. It can reduce the loneliness of long nights, help users notice patterns they might otherwise miss, and offer a starting point for self-understanding. Used thoughtfully, AI can support therapy, not replace it. But the warnings for this population must be significantly louder because the risks are not mild. They are structural, unpredictable, and potentially dangerous. Serious mental illnesses require trained clinical care, not conversational algorithms. AI cannot reliably distinguish between mild distress and a crisis. It cannot recognize manic acceleration hiding in optimistic language or the subtle cognitive shifts that precede psychosis. It cannot hear affect, observe body language, or sense when someone is dissociating. Serious conditions often show up in nuances that only trained clinicians know to look for, and an AI, no matter how eloquently it speaks, simply does not have access to those clues. One of the biggest risks is misinterpretation. People with depression or suicidal ideation may express hopelessness indirectly through metaphor or coded language, and an AI might mirror the tone without recognizing the danger. Someone in a manic phase may describe impulsive plans with enthusiasm, and the AI, trying to be supportive, may reinforce their excitement instead of gently challenging it. Someone experiencing psychosis might describe unusual beliefs, and the AI may fail to differentiate delusion from creative thinking. These errors are not small, they can deepen symptoms or delay intervention during a critical window. Another hidden danger is the false sense of safety that AI can create. When the system uses warm, stabilizing language, people may feel as though they're being monitored or understood, when in reality, no actual clinical oversight exists. A person with PTSD might talk through a flashback, misunderstanding the AI's calm tone as evidence that they are being therapeutically guided. A person with bipolar disorder might rely on the bot for mood regulation, believing the AI can coach them out of instability. Because the AI is always available, always patient, and never overwhelmed, the emotional pull can be powerful. But this comfort is an illusion, and relying on it instead of real medical care can lead to worsening symptoms or missed early warning signs. There is also the risk of reinforcement. AI models often mirror the user's emotional style. If someone with depression uses self-blaming or despairing language, the AI may respond with excessive validation rather than the structured, evidence-based interventions needed. Someone with trauma might repeatedly revisit triggering memories, and the AI, lacking the boundaries of a therapist, may unintentionally encourage unregulated re-exposure. A person with an eating disorder may hint at harmful behaviors, and the AI might offer general motivational language instead of crisis-appropriate guidance. Even small missteps can have big consequences for people whose mental states can shift quickly. Yet despite these warnings, AI coaching can still play a positive role if used within a well-defined, safe framework. Individuals with serious mental illness can benefit from AI-assisted journaling, medication reminders, sleep tracking, or mood logs that help them prepare for therapy sessions. AI can reduce some of the friction of managing daily routines, making treatment plans easier to follow. It can offer grounding prompts during moments of anxiety or help someone explain their feelings more clearly to a clinician. These are real advantages, but they must exist as complements, never substitutes, for trained human care. The safest approach is clear. People with serious mental illnesses should never rely on AI as their primary source of support. AI should not be the place where they seek crisis help, diagnostic guidance, or therapeutic interpretation. Instead, it can be a tool that fits alongside clinical treatment, a kind of digital notebook, motivator, or organizational assistant. The human oversight must remain central. Clinicians bring judgment, intuition, ethics, and responsibility. They understand nuance, can detect danger, and can intervene. AI cannot. The greatest positive potential of AI coaching emerges only when it's woven into a larger care plan that prioritizes human expertise. The greatest danger emerges when people begin to believe that AI's soothing tone equals safety. For individuals living with serious mental illness, that illusion can have consequences far beyond a misunderstanding. It can shape the trajectory of their condition. Respecting the technology means respecting its limits, and for this group, those limits matter more than ever.